Welcome to the Bone Health Clinic at Cancer and Hematology Centers of Western Michigan. The goal of this clinic is to provide patient-focused care to optimize bone health. The purpose of this brief video is to provide information on bone density, how it is evaluated, and what can be done to maintain or improve bone density. Bone density is evaluated using dual energy X-ray absorptiometry, or a DEXA scan. T-scores and Z-scores are used to make a diagnosis or determine the current health of your bones. Status of bone health can either be described as normal bone density, low bone mass or osteopenia, or osteoporosis. A FRAX assessment is performed if bone density is in the low bone mass or osteopenia range. This is an evidence-based tool that takes various risk factors for a fracture into account to calculate a 10-year risk of fracture. Osteoporosis literally means porous bones. This is when too much bone is lost, too little bone is made, or both. Our bones are living tissue that grows and changes throughout our lives. The result is porous bones that become weak and can break. The hip, spine, and wrist are the most prone to break. However, other bones can break too. Breaking a bone is a serious concern, as this can cause ongoing pain, loss of mobility, or decreased quality of life. Bone density can decline due to a variety of reasons. Conditions such as autoimmune diseases, hematologic or blood disorders, eating disorders, endocrine disorders, and cancer can all negatively affect bone density. Lifestyle choices such as alcohol use, tobacco use, and lack of weight-bearing exercises can also cause a decline in bone health. Finally, medications such as treatment for cancer, androgen deprivation, anti-hormonal therapy, and prolonged corticosteroids can lead to loss in bone density. Medications, supplements, and lifestyle choices can all play a role in maintaining or improving bone density. Medications such as bisphosphonates, anti-rank ligand, or anabolics are used when an individual has osteoporosis, low bone mass or osteopenia with an elevated fracture risk, or a history of fragility fracture. Medications are used to maintain or, in most cases, improve bone density. As for supplements, calcium and vitamin D are the gold standard. By assessing your current calcium intake and monitoring your vitamin D level, we will make recommendations for the appropriate supplement doses. Total calcium intake should be around 1,200 milligrams daily. Take calcium in divided doses, as only 600 to 800 milligrams of calcium is absorbed at a time. You can find both calcium and vitamin D in a combined pill. Additionally, calcium citrate is better absorbed than calcium carbonate, as this must be taken with food. If you don't get the amount of calcium your body requires in a day, it is taken from your bones. This ultimately leads to more porous bones. Often a blood test is done on an annual basis to evaluate vitamin D levels. One must be sufficient in vitamin D to best help bone health. However, high doses of vitamin D supplementation are not found to be of greater benefit. Therefore, we want to make sure you are taking the dose that is appropriate for you. Weight-bearing exercises are the final component that help maintain bone density. It is recommended to use your own body weight or additional weight to build strength 2 to 3 times per week for about 15 minutes each. Shortly, you will meet with one of our nurse practitioners who is specifically trained and certified in evaluating and treating bone density. We hope to work alongside you to help in optimizing your bone health and ultimately maintain your quality of life.